what I'll do is I'll introduce our speakers in one go and prompt them as we go along, but also tease out a few questions from the chat box as we go. Et pour nos amis francophones, bienvenue. Si on a des questions, on peut s'écrire dans le chat box. Malheureusement, on n'a pas de traduction simultanée. And just by that, I'm sure you'll have picked up that we're not going to have very much French translation in the session, but we're hoping to try as we can to tease those out. So we've got assistance from our French-speaking partners to try and do that. So please don't feel free, don't be held back by that. So I'm hoping that Udaman has joined us, and I'll begin with introducing our panelists today. First, we're going to hear from Hamzat, who's an activist that has successfully led grassroots organizations and work in over 40 countries on the continent in the space of about 9 years or more, and focusing on the nonprofit sector. Hamzat is also the founder of the Follow the Money Network, or Follow the Money, which is a Pan-African grassroots movement. And at the moment, also, I don't know where he finds the time to do all of this, but he is currently the Chief Executive of Connected Development. Really excited to have Hamzi on the call and to hear his reflections, particularly on the Pan-African perspective. We'll hear from Masana Ndingakanga, who is the Crisis Respond Fund Lead at Civicus World Alliance for Citizen Participation. Civicus is also quite a mass-based organization in that it brings together over 9,000 civil society actors from around the world. Masana's work looks to ensure that civic liberties are respected for groups advancing human rights, with a particular focus on women and women human rights defenders. She is quite a talented human being, and excited to hear that she's also produced a documentary and worked and authored a chapter in a book. Welcome, Masana. Very excited to have you. Musa Kondo will be our third speaker, and he's a 2015 Mandela Washington Fellow. He works at Accountability Lab in Mali. Accountability Lab has a reach beyond Mali in terms of other African countries, and they focus on countering misinformation. In the context of COVID-19, we feel that's quite important, and we look forward to hearing from Musa what his reflections are on the role of young leaders in particular in countering myths around the coronavirus, its transmission, and so on, but in particular around reflections on the COVID-19 pandemic and post. Wanjiru Gikonyo is a founder and network director at the Institute for Social Accountability in Kenya. TISA is a civil society initiative, and they work in looking to really provide sustenance or promote sound policy and good governance within the local government space or local development space in Kenya, and also looking to uplift the livelihoods of the poor and marginalized. Quite excited in particular because TISA has done some amazing work in the context of accountability and the devolution context in Kenya. So we really look forward to hearing about your work and with the banner and umbrella of social accountability. Last, but certainly not least, and we're hoping, I'm sure he's on the call by now, Udaman works as a project manager at Tracker, which is a community tracking platform that was developed by Budget Nigeria. In his work, Daman is engaged with several citizens and looks to empower people to be able to track government projects that are funded by, using public funds. He is also one of the he was an Obama Foundation leader, emerging leader in 2019, selected out of leaders from 45 countries. So really looking forward to hear about his work, and in particular, again, innovative ways about following the money and what reflections we may have in the context of COVID-19 resourcing. So without any more time wasted, we'll hand over to Hamzat, who will be speaking to us in his capacity in the Follow the Money work that he's been doing, and more recently in the COVID-19 context. Just recently seen a CNN coverage of your work, Hamzat, so eager to hear from you. So please, go ahead and take it over, Hamzi, and if you'd like to share your screen, you're welcome to as well.
Oh, thank you. Thank you so much. Okay. Um, my name is Hamzat Lawal, and I like to be called Hamzi. Today, I will take you through our campaign on following COVID-19 money. Follow the money, try to answer where funds are coming from, where they're going to, but most importantly, how judiciously these funds are being utilized, particularly at the grassroots. After the incident case, after the first case of COVID-19 in Nigeria, government, individuals, private sector started contributing resources towards tackling COVID-19. And for us, and since government institutionalized a lockdown, what we started doing was mapping and aggregating this financial data on a public Excel sheet. Um, Of course, we all know about the virus, so I would not talk more on COVID-19. But why are we doing this? We know that corruption has plagued the continent. Annually, it's estimated that in my own country, we lost over $5 billion annually due to corruption. And if you look at corruption index, we're not doing quite well. And for us, we wanted to inform policy around the utilization of these public resources, but also to inform how international multilateral institutions and development partners would invest resources in where there's no much attention in responding to the crisis. This campaign started in Nigeria, and our colleagues who run Follow the Money in Kenya, the Gambia, Zimbabwe, Malawi, Liberia, and Cameroon took this campaign to their country using their own local context to run the campaign with the hashtag Follow COVID-19 Money. In Nigeria, what we did, apart from aggregating this data, was also to use policy and legal instrument like the Freedom of Information Law, where some of you know it as the Access to Information Law, to write government MDs like the Ministry of Finance, the Accountant General of the Federation, the Ministry of Humanitarian Affairs, to ask them for information on resources that have been committed. In my country, our president set up the Presidential Task Force on COVID-19. And with our campaign, we were leading conversation on social media and also using this information to build, to counter fake news and misinformation. And we worked with the Premium Time Center for Investigative Reporting and the Cable Foundation to do fact-checking and also counter misinformation and fake news. In Kenya, what happened, the government set up a team, a task force also, and sent a budget appropriation to Parliament, which was published on the National Daily. So what our colleague did was to take this information, scrape this data, and started a series on Twitter called Kenya Budget Series, sharing this budget information, but also getting feedback and aggregating this feedback and submitting it back to Parliament as citizens' input, on resources that are committed towards COVID-19. They also collaborated with different civil society organizations and documented knowledge management. They also leverage heavily on radio stations. So they have a Ghetto FM where they target vulnerable people and informal settlement because government was providing palliative. So they were using this platform to share information around this palliative. Governments are providing incentive and feedback if they're enjoying this resources provided by government. In Liberia, our colleague in Liberia, interestingly, is part of a government board that focuses on providing water, sanitation, and hygiene services in public spaces. So during COVID-19, our colleague in Liberia was also part of the board constituted by government to respond towards COVID-19, sharing knowledge, sharing information, and ensuring that they advocate for citizens' engagement. So our colleague mapped all the resources donated both by the World Bank. The World Bank gave them about $10 million, and other multilateral institution and the government resources that were channeled towards COVID-19. And in doing this, they were also countering fake news and misinformation while leveraging on radio to disseminate information. In the Gambia, interestingly, so what happened was they got over $10 million from World Bank. They got resources from EU and the US Embassy, and the government also committed resources towards COVID-19. So these resources was one meant to set up a treatment center. Some of us call it isolation center for COVID-19 positive patients. And our colleague did an underground investigation, visiting all this clinic, in the subnational level, collecting data and also interviewing patients that were COVID-19 positive, of course, using CDC guidelines, and gathered corruption information on how government officials were embezzling this monument for COVID-19. So they published the report and submitted it to Parliament, which informed a public debate in Parliament where they invited the Minister for Health, who was coordinating COVID-19 intervention, and he said publicly that yes, there've been series of corruption ongoing under his ministry, under his watch, by other government MDAs that are part of COVID-19 intervention. In Zimbabwe, our colleague worked with the Ministry of Health and CDC in the country to build a COVID-19 tracker to track COVID-19 resources, but they also build hotspots using Google Map to do contact tracing and putting in place data around which area, which suburb is a hotspot zone, so that citizens would not visit that area, and also take preventive measures, and which they call the movement tracker. They've held a virtual hackathon where they collected a lot of COVID-19 app around how citizens can respond, and supporting these citizens to also connect them to government to provide these resources. In Cameroon, our colleague, and Cameroon is a English and French speaking country, so our colleague used radio, but also mapped how much money has gone to the COVID-19 response team, over 880 billion CFAs, and also using French to disseminate this information. Interestingly, one of our major challenges in Cameroon, and maybe if I can share, is that we've been receiving series of threats from faceless accounts on social media, Facebook, Twitter, threatening our colleagues that they're complicit to supporting spies to make the government look bad. Till date, by the way, the president of Cameroon have not addressed the country around COVID-19. In Malawi, our colleague have also mapped both income and expenditure, and part of a larger civil society group demanding accountability in the utilization of COVID-19 response in various district level. In Malawi, we're also collaborating with investigative journalists who are doing on-the-ground reporting and using social media to amplify corruption that have been identified in the area of misuse and abuse of COVID-19 resources in Malawi. And for us, why are we doing this? Beyond ensuring transparency and accountability, is providing citizens with evidence-based data around how these resources are being utilized, particularly at the subnational level. Now that we've experiencing across Africa community transmission of this virus. In doing this, we're also building public trust in various institutions and creating platforms for dialogues and informed debate. So since COVID-19, we've held series of webinars, and in hosting these webinars, when we had one of our initial webinars, we had the director from the Bureau of Public Procurement. Nigeria has a procurement law that also helps ensure that open government partnership is institutionalized. So after our webinar, a guideline for procurement was released by government, and we've also gotten a guideline from the Independent Corrupt Practices and Other Related Offences Commission, just to prevent corruption around procurement during emergency, which we informed. And in doing this also, we're reaching millions of left behind citizens at the grassroots level, where we, for now, we're now institutionalizing outreaches. Before now, since the lockdown, we didn't undertake outreach, but now the lockdown have been eased, and now we're doing a lot of outreaches, getting feedback, collecting data from citizens to inform government policies and decision making around COVID-19 as we also reduce corruption. Thank you.
Great. Thank you so much, Hamzy. That was great. We're still collating some of the questions, but an immediate one I'm sure that will emerge is, will likely relate to the pronouncements in terms of fake news or claims in that regard. In the context of social accountability, very interesting to hear that, and interesting to hear what your responses would be. Masana, are you, I think our screen is, it may just be my screen, but I hope you're able to share yours.
Unfortunately not able to share my screen at the same time as this image from Hamzy is on.
Yeah, I think it's somehow coming off quite slowly, Hamzy's screen. Kai, I wonder if you could perhaps, if you are able to unshare on behalf of Hamzy, because I think it's frozen on our end. Yeah, but perhaps in the interim, Masana, if you're able to speak while we go, and you could also have your video up if you prefer. But let's proceed.
Sure. Okay, great. I'm happy to just speak as I go. I'm just going to set my timer. Just because I have my slides open in front of me, I won't be able to see when the screen is ready for sharing. So if someone could just let me know when I can start sharing, that would be great.
I think you can start sharing now. Sorry.
Yeah.
I've ended.
Oh, amazing. Thank you so much. The chair, does that mean my 10 minutes can start from now?
Yes, please go ahead. 9.
Okay, great. All right, let me reset my stopwatch and put this on presentation mode. So really grateful to be able to be a part of this conversation. I'm sure a number of you have engaged with Civicus on different platforms. We work primarily on civic space, not just within the continent, but across the world. One of my roles is to respond to partners who are facing crises in civic space, matters related to freedom of assembly and association, which is part of the Lifeline Embattled CSO Fund. So really grounding this conversation in systemic change as part of the Atlantic Fellows for Social and Economic Equity, based at the London School of Economics Global Fellows program. We've been having a lot of conversations around inequality, and I think reflecting on inequality is critical for tracking COVID-19 expenditure and outcomes, but also accountability. In the current political economy, the emphasis on poverty studies has largely presented interventions, policy interventions and practice interventions on addressing the vulnerabilities of those who are forced to live on the margins. And this has come part with sort of the value for money framing in the developmental world, alongside international financial organizations and institutions, justifying the financialization of public services and goods through cost-benefit analysis and basically the commodification of livelihoods for partners around the world. And why we need to foreground inequality analysis in this conversation is really to shift to systemic interventions, to move away from minimums to maximums, and accountability for excessive accumulation and extraction, and the justification for basically harmful resource allocation. And I think in this context, South Africa presents the quintessential post-colonial case study of a social democracy that is integrated into a racist, misogynist, ableist, extractive global political economy that does not work or does not drive its indicators or its performance on social justice and human rights for all. And the growth-based economic policy framework has basically exacerbated existing fault lines, not just in South Africa, but we're seeing across the world, where governments frame civil society as civil society's work in human rights as being counter to growth. And we see, for example, with the African continent free trade agreement, how this is sort of navigated in weighing up the extractiveness of large economies in the free trade agreement and the negative effects that we could see on livelihoods, because wealthier African countries would then be able to externalize vulnerabilities and creating basically new types of economic exploitation and resource extraction and taking the place of the West. So a new type of solidarity across the continent is needed, and Civicus has done some work around the civic space implications for this type of thinking. I'm going to quickly shift to the South African wealth context, because I think wealth inequality combined with financialization of public health infrastructure has basically exacerbated vulnerabilities in global value chains through tax havens, illicit financial flows, evasion, and I think corruption, as has been mentioned by Hamzi. Right now, we're just coming out of the stage 1 of the government response, which included a 500 billion rand relief package, where the state declared a national disaster, offered tax relief and disaster relief funds, particularly through the temporary employer-employee relief scheme. However, within this, there's sort of a gap in society, particularly around migration for unpaid care work, those who engage in social reproduction, migrant workers, and sex workers. And we see really vulnerabilities and externalization of these vulnerabilities in a deeply xenophobic, racist, and sexist state, at least in its policy framework. However, those who are able to access legal frameworks and the courts, such as the Casual Workers Office, Women on Farms, and Izwi Domestic Workers Alliance, have been able to include within this relief package and the 350 Rand for every citizen, those who have not formally contributed to our unemployment insurance fund. But for those who aren't able to access these court processes, there is an inherent discrimination. Also under stage 2, which we're moving into, when South Africa received the downgrade to junk status in March 2020, at the beginning of our own crisis, we have the highest number of cases of COVID-19 in the continent. We need to also center and foreground how these credit rating institutions then affect the vulnerabilities of those within the continent. South Africa is also requested an IMF loan recently of $4.2 billion. And the state has consulted with unions who themselves have contributed to the downfall or the shortfall on the state side of a $3.75 billion loan that was taken out in the 2000s, which has not yet been completed. So again, systems thinking is critical when we're thinking about the stage 3, which is the recovery of the economy, and can we really justify this recovery if it's built on this conception of trickle-down economics and really one of the most unequal societies in the world. And just to paint a picture of what that looks like and where all of these resources are going, is that the top 1% or 3,500 people in South Africa own 15% of all wealth, whereas the bottom 50% or 17.7 million people have a net wealth of negative 16,000 Rand, right? So we see that wealth and the extraction of resources from the public account has ultimately resulted in the perpetuation of vulnerabilities. And importantly, I think to foreground that 90% of South Africans, or the bottom 90%, control only 14% of all wealth. And yet, even within this framework, when we're thinking about COVID-19 responses and state interventions into SMMEs, we see across the board that those companies that are being closed and unable to pay their workers are predominantly those that hire those within the informal economy. And yet, the capital gains tax in South Africa has remained quite constant over the past 4 or 5 years, maybe 3 years, sorry, it's not 2021 yet, where there isn't any increase on capital gains, which ultimately is stripping the public account of resources that are needed for public health infrastructure. And very quickly, I think this leads to my last slide is, what does transparency, accountability, and participation look like in this context, not just for South Africa, but across the continent, across the world, really. There's been extensive work on illicit financial flows, tax evasion, and tax havens. And yet, you know, an articulation, particularly for those businesses who make use of these tax havens, there hasn't been enough conversation around, if you're making use of them, you should not be able or eligible for state interventions or state resources to then finance your vulnerability through the state account. And we see examples of this in Canada, Denmark, Poland, and Scotland. But there's also a longer term question of tax justice for multinational corporates and how they're able to financialize political participation and shape public policy in their interests. Also a question of local businesses and high net worth individuals across the global political economy and their influence in public expenditure. I think on the civil society and accountability and a participation framework, a lot of the funding that has been issued to states has been around humanitarian interventions on access to food, universal unemployment insurance, but there are continuous gaps in monitoring police brutality. For a number of us across the continent, there is a gap in engagement with the state, so an absent state, and civil society has often stepped in to be the de facto state. And now through the COVID-19 pandemic, people are encountering the state, but oftentimes in ways that are violent and brutal or extractive, or that are built on surveillance and monitoring rather than public service delivery, particularly for peri-urban and rural environments. How do we also then ensure effective monitoring of the IMF loan? And I'm personally, as a recovering economist, as I like to call myself, on the spectrum, you know, how do we shift our conversations from just resource accountability to debt justice, given the historical legacy of colonization and how that has shaped the inherited public finance infrastructure available to our states. Lastly, I think as well on civil society participation, I know I have 20 seconds left. We see that civic space restrictions have to be eased for effective accountability and participation. And as in the case of Hamzi, we're seeing with partners across the continent, we've never received this amount of applications before of intimidation from non-state actors. And I think I just want to say lastly, I'll share the slides later, is that we might be facing a new 9/11 in terms of civic space legislation, where post 9/11 we see the rise of counterterrorism legislation that's used to crack down on civil society, not just in the continent, but around the world. And now we're seeing really state mandated and legitimized surveillance and infringement on freedom of expression. And how do we ensure that even in our accountability, our participation and our transparency, that we're able to monitor these responses as well? And the state has a rollback plan for its civic space infringement post-pandemic. Thank you.
Wonderful. Thank you so much, Masana. And thank you for making my job easier by not having had to stop you in terms of timing. That was brilliant. And I think just to reiterate to our participants to please share as you can as we go in the chat box any questions you've got. We will at the end as well have a bit of space to kind of have to verbalize our questions. Perhaps also just a bit of housekeeping. We've unfortunately lost one of our speakers. There's a storm in Lagos, and that's disrupted his connectivity, which does mean though we do have a bit more time to interact, which I think is a good thing. But it's unfortunate to have lost Udaman from Tracker in Nigeria. Next, we have Wanjiru speaking to us, who's the director at TISA in Kenya. Wanjiru, would you like to take over?
Yes, Thank you so much, Zukiswa. And I have notes. I don't have a presentation to make, and so I'll try and keep time because slides in a way enforce a discipline. So the outbreak of COVID in Kenya found our public health and economic systems extremely vulnerable. And this is because of the investments that government has been making. Health investments, which have averaged about 7% of GDP over the past few years, compared with the recommended 15%, means that investments in healthcare have been low. But looking more critically at health investments, we also find that the spending has not been on public health, primary and community health services, the lower level service delivery that would enable a robust response. And in fact, there's been high levels of corruption in the health sector based on some of the national spending around health. Again, informal sector in Kenya comprises 82% of employed. So 82% of Kenyans who are working in the informal sector. Yet this sector again is underinvested in. So government is spending in other sectors as opposed to where majority of people are working. So we've seen, for instance, agriculture, which is a big employer in Kenya, the primary employer. We've seen decreased investments and lower levels of growth in critical agriculture. We actually note that a large percentage of the development budget in Kenya is going towards large-scale infrastructure. And this is what has informed our response or our interrogation, our engagement in the COVID response. So COVID found Kenya at a point where we were facing jobless growth. And this growth is very much linked to the high level of debt in the country, because the country has been running, government has been running a large fiscal deficit. So we had just begun to advocate around the issue of debt and the extent to which it was impeding service delivery, because after paying recurrent expenses, after paying salaries, really there was not much money for development, let alone a response to a pandemic or a shock, an economic shock, a social shock of this scale. So high debt repayments, which are at about 46% of local government revenues at present, have really impacted private stock has been decreasing. Private sector has been very heavily impacted. And like I said, we've been seeing this jobless growth. And I'd like, before I speak about the COVID response, I'd like to speak to why this is a very unusual situation in Kenya. Because in 2010, we enacted a new constitution. And this constitution is based on democratic and accountable governance and has very robust provisions for political accountability, budget transparency, public participation, a very robust framework. But we have seen this framework and the laws that have been enacted under it unable to check the executive from making budget and debt decisions that undermine basic service delivery, that have essentially undermining economic growth and security. And we have moved away from the term corruption, and we are now using the term state capture, because we have seen a repurposing of state institutions for public gain through interaction of politics, government, politics, private sector. We are seeing a level of repurposing of state institutions, laid down laws to an extent we've never seen. And so what then happens is that the large national flagship projects have become so overbearing on development that for our institution, for instance, we focus on local governance. We focus on, we are advocates for effective devolved government. But you find then that the local level governments are not able to operate because the national priorities are then eating up such a large percentage of the budget. Decisions around debt to finance flagship projects are then, really squeezing out all the money into those large infrastructure projects and into the debt repayments to finance those projects. And in fact, when we drill down, we identify one of the large causal issues is there's one big flagship project that really triggered this descent that Kenya has had into what we consider a debt trap and a debt crisis. And as civil society, we've been talking about a debt crisis where IMF was saying, Kenya is actually on an even footing and, is very, very low level risk, was then ranked to moderate risk, and now is actually inching towards high level risk. And caution, a red flag has been placed on Kenya's debt situation, a situation we had identified. So what has state capture done in Kenya? State capture has enabled large infrastructure investments that are non-productive and debt negotiations that are then not favorable. They're expensive short-term loans because this state capture has seen a centralization of power, has seen an undermining of judicial independence, has seen a really co-option of parliamentary oversight, has seen securitization of the state, clamping down of freedom of protest. So Kenya actually is in a very unusual situation because we have a very democratic constitution, but we are experiencing severe reversals. So government has then had a pretty robust response, or as robust response to COVID as they could, with public health measures, some what we value as would look at as token economic measures. But these then have been undermined by the scope of the problem and the government being unable to respond to the problem. And because I can see my time is low, I'll cut straight to the status on transparency. The government did enact a COVID fund legislation, but we then note that government spending around COVID is not aligned to that law. We have actually on paper a high budget transparency record, but crucial budget data is missing. So you can have records and reports published, but we then don't have a debt register. We are not publishing, contracts around our debt. So we've got loopholes in terms of our debt transparency, and we have a misalignment between our budget appropriation and expenditure. So it becomes very difficult to track where money goes once it's appropriated. So we also don't have a community-based targeting mechanism. So the social kind of interventions that government has made to support households are then not targeted. And we have questions around who is getting the money. And civil society tracking is raising questions around this. So what have we done under the platform? We are raising awareness about the challenges to do with debt. We've been advocating with Parliament, with the IMF, with other key policy stakeholders around debt, around transparency, around the need to get assistance to those most in need, and around the need to have a robust discussion around this. And of course, we are then planning and looking at how we are going to use the legal mechanisms that are available to push for political accountability. The last thing we are doing is pushing for debt relief. And we've recently connected with the Jubilee campaign on debt relief to do that locally and also at a regional level. I'll stop there. Thank you.
Great. Wonderful. Thank you so much, Wanjiru. Yeah, I like the focus in terms of the local government space. And I think perhaps an immediate question that's running through or threading through the presentations is around what does that mean for systemic future changes or systemic future action in relation to civil society interventions? So I'm being kept on my toes quite a bit at the moment. It does seem that we have actually gained back our our fifth speaker, who now I'm not seeing on the screen. But in the interim, I had skipped over by mistake Musa, who is from Accountability Lab, and I'll be sharing Musa's presentation on the screen. Musa, you can take on over.
Hello, can you hear me?
Yes, we can hear you, Musa, and yeah, I'm hoping you can see your presentation.
Yeah, hi everyone. You can just scroll down the first page, please. So, hi everyone, my name is Musa Kondo from Mali. I work for the Accountability Lab, which is a nonprofit working in the different countries in the continent and also outside the continent in Asia, established in 2012 by a man who worked with the World Bank and different organizations around the world and got opportunity to really understand the problems on social space and also how the problem is working between the government and civil society and also citizens. And so one of the main objectives of Accountability Lab is to make governance work for people all around. So starting elsewhere, the Mali chapter starting in 2016 with the flagship program we call Integrity Icon, and which main objective was again to get people and citizens all around the country engaged in the conversation, so in order they can participate in the process of development from local level and bottom-up process, so they can be part of the conversation and also give their feedback, give what they think to make governance work for people. So since a couple of years, we've been doing this, and we're starting this with the COVID-19 pandemic, which hitting everywhere in the world and obviously in Mali. And one of the particularity in my country has been the way people receive the news and also how they treat the information and how they take action from what they receive and how they deal with it in the daily basis. So from this angle of that, we've seen from different countries of where Accountability Lab operates. We started the civic action teams, a campaigns bulletin daily produced. So what you see right now is the prediction of the 11th of June. So a couple of days ago. So these are not the right figures today. So just to show you what the bulletins looks like and how, which kind of information we try to capture to spread around the country. So we first started with myth tracking, rumors, and fake news. As you know, since the beginning of this pandemic, there was a lot of information circulating. Even the WHO was not able to capture the right information, the right fact, and also spread this around the world. So Mali, as part of one of the poorest countries and one of the most corrupt countries in the continent, and also with a lot of people who have not been at school. So that means they just receive information from literate people. So they just get the information, not a lot of analyzing, and just take advantage of what they have. So our role as Accountability Lab office here was to create a team to work on capturing and debunking the myth based on the contextual and also contextual and ethnic group and a religious fact about the first information coming from outside, from the WHO, from different origins about COVID-19. So this being part of like when you are Black, you cannot get COVID-19, or when you live in the hot space as Sahel countries, you cannot you cannot get COVID-19, or when you read some verse from the Quran, you cannot get COVID-19. So this first work guide us to do a lot of work on daily basis to inform people by producing this bulletin every day, bringing the new cases, bringing whatever information is going on, and we double check everything from the WHO representation here in Mali and also the Minister of Health and also national commission established by the government to face this pandemic. So by bringing solution and also social support from the government. So the second leg of this bulletin we produce every time was to follow the money. As you've seen here just on the screen, we first started by tracking the different donation and debt relief from international institutions towards the government of Mali, so they can take advantage of this funding, or also particular or individual donation to the government as the last basket left down as the government opens a bank account. So people or individual can give donation, or local enterprises or local businesses to support the fight of coronavirus. So we've seen there was some donation. The government, the commission itself was not mentioning this openly, like they were not communicating around this. So we say, so if they are not communicating around this donation, so where this money is going? And the first days, the first 2-3 weeks also, we've seen, despite a lot of donation coming in this account, and also international organization, the UN, all these organizations giving money to the commission, like the healthcare workers, professionals have been facing a lot of problems to even have face mask or blows the word to face the challenges as on the front line. So we were asking where this money is going, because we know and we see every day the money is coming, but the ones who are really in need and urgent and emergency need right now, gloves, masks, and also to train them on what is COVID-19, how they as healthcare professionals should work and should protect themselves and protect others and create space to put people in quarantine, and all these things supporting the fight was not happening. So we start producing this and focusing much more on tracking every single cent coming to the government, and asking the question, we know what has been given, from who gives this money, and what is the quantity, the number, really number, as you can see, is like 474 billions of CFA right now, what we have from the government account. But there is the other side, there is any kind of information about what the money has been spending. So these have been a lot of questions. And then we're producing this bulletin in French and also in local language with Bambara. And then we spread it all around through emails, thousands of emails, WhatsApp groups, and also community organization and association, and also radios, community radios, so they can translate in the local languages, whatever they are, and the different places they live, so they can translate this to access people, this information. So we put in place like different types of volunteering also, so they can follow and help us work in these informations. The one part, the work and information based on this context and also religious fact. And the other side, the other teams are working with to follow every single actions from the government, so we can track down everything to put in the same basket, so to make the information more access to people and also more open, so everyone can read whatever and whoever about what's coming on or what's going on around the funding of COVID-19. The other part also we work a lot in this following the money process is a lot of officials in the government take advantage of the emergencies and completely disrupt with the procedures, like the procurement procedures on how they should do like public procurement, contracting with the individuals. So they take advantage of this by giving direct contract, and even they can get money back. So we try to communicate a lot of this, like how or what to do to make them more accountable on the way they use money. Because if people, the mass public don't know exactly how much we have or what fund is used for what, this can create a lot of confusion. And at the end of the day, they would just justify everything by the emergency. Like we were in emergency, we do this to make things happen. But we think this is really not completely true. and they can take advantage, they can be sure like how they use the money and to respect at least certain procedures to get things done. And also the other questions we're focusing much more in Accountability Lab is what we are going from this. So we know in terms of health, securities, health techniques, health materials and platform we have is really poor. And also we've seen a lot of funding coming to support the COVID-19. So how to make sure some of this money can be used to secure some materials from the health sector and also guide more long-term investment with this money than just put money in the things we don't obviously need right now. So we started this conversation with different partners here and different local organizations to make sure we can take advantage of this COVID-19 to think differently, to take decisions differently, to see the future differently from what we're doing right now, because we're sure from where we are now, right now, things will never be the same. So how to be prepared as a country, as a civil society organization, as citizens to take to think differently, so we cannot be in the same situation as we are right now. And also after that, we engage people in the ground to sensitize people, to engage them to follow directly, very closely what's going on. It's not just saying COVID-19 is this, is that, but what's happening around the COVID-19 in the country and how they can take part of this. Because without a kind of pressure, without a kind of interest of population and people, the government, the ones who are managing this funding, will not take things seriously and they will not be accountable. So we are pushing them very positively, not being negative or insulting or doing crazy things, but we try to say how very creatively and very innovatively to make them accountable first on the decision they're making around the country, around the COVID-19 for the country. Is these decisions are really good for people, or are they just good for themselves? Or also the way they're managing the funding, the way they're receiving the funding, and the way the expenditures are going, and how they're obliged to be accountable at the end of the day. So I will stop here for now. Ready for this question, so to come back for that.
Merci beaucoup, Moussa. Thank you very much. Yeah, I think we will hold it there and hear from our final speaker on the panel. Before we open up for questions, I do see there are some fantastic questions in our chat and some observations. Udaman, I'm not actually seeing him on the screen, but I'm hoping he has joined us. Yokai, you had indicated he had. Excellent, great. Udaman, you're still muted.
I apologize for joining late due to internet connectivity because of the heavy rain downpour here in Nigeria, in Lagos precisely. So actually, when the COVID-19 started in Nigeria, is a thing that we never expected, and you know, our government is a government that they don't really pay attention to citizens, so they pay attention to things that will favor them. So when the whole thing started, we had international donations from foreigners, and also donations from big organizations in Nigeria, and also individual. So we as citizens, we also try as much as possible to see how these funds are being expended because of the cases of how this money were being spent. So we discovered that the numbers, the figures are rising, and people still complaining that they're not getting the exact treatment from the respective isolation centers in the country. So we also tried as much as possible to build a platform called COVID Tracker platform. This platform enables you to track of how the funds are being expended, as follow up with donations from respective donors to see if actually these funds are being utilized. Then the government also try as much as possible to introduce 3 platforms. One, which is the conditional cash transfer, then all the 2, the conditional cash transfer, then 2, there's a program going on before, they call it home school feeding, which they also incorporated into this scheme to say, okay, now since the schools are on holiday, we can also see how they can still continue this program despite schools are on holiday. Then also the palliative, which were distributed to states that were badly affected. So we try as possible to see how we can also see how we can track this fund, because we know our government, they pay more little attention to health sectors, because all our health facilities in Nigeria are in a very dilapidated state. So we are not really prepared for this. So we try as much as possible to also look at it. But recently, the budget for health was also reduced by almost 25%, which is not too good for this kind of season. So we also try to compare the amount that has been donated by the respective donors and individuals, and also to try to measure if actually these funds have been well expended. So things like that. So that's what we've done so far in budget, and also try to see how we can also use our data to follow up with the donations and how these funds have been expended in Nigeria.
Great. Udaman, is that you happy? Okay, I see you are muted. Thank you very much for that. And I'm glad that you were able to join. I do see that Olusegun has also shared a link with everyone on the COVID tracker work, which I think, yeah, thanks for that. So yeah, this is now the opportunity for our participants to share some questions and reflections. And we've been collecting from the chat box. Thank you to all our speakers. I did get sidetracked, so my timing likely was a little bit off, because I did find a lot of, all of the inputs really fascinating and interesting. So what I'll do now is share the questions that we've been able to collect. And what we will also do is to ask, in fact, if we could ask our speakers to put their videos back on. And with those questions, we'll just go in the order that I announced them. And then I think we can have space to have some additional questions depending on how we go. So the first question to Hamzi is asking to what extent technology has and the internet has been an issue in the African context that you work in. You described a range of contexts in relation to citizens' ability to engage and access data using the tracker technology. That's the first. I'll just go through all of them, and if the speakers could just note them in that order and take them in that order. The second observation, or an observation to Masana, is about, Brendan says it's a great broad lens on equity and accountability. What are some of the implications for our collective efforts going forward? And another question to Masana, do you see any link between the COVID situation and the need for civil society to follow and support the policy formation at the UN on human rights and international solidarity? Africa needs to be heard by the West that underdevelopment in some parts will always affect other parts of the world. Hope I wasn't too fast with that. To Wanjiru, what is the context of transparency and participation for the COVID-19 debt that you spoke to? And I'm assuming this question is specific to the Kenyan context. And then I would like to just perhaps add a question to all our speakers, and in particular to Udaman and Musa, around what would your reflections be around some of the key areas that we would need to look out for in terms of future follow the money interventions that are post-COVID. So a lot of what we're hoping to gain out of this session as well is what are some of our lenses and perspectives that perhaps should change or could change in accountability work in following the money and financial tracking. I'll leave it there for now and just perhaps go in that order. With Hamzi going first.
Well, thank you very much, Suki. Technology has played a big role because, well, during the lockdown, the only way we could actually communicate was leverage on technology and also infrastructure that we've built before now. And for us, why it was even easy to launch the Follow the Money, launch a Follow COVID-19 Money campaign was because of our digital architecture and infrastructure that we've invested hugely on the ground and have trained over 3,000 young people, in all the municipality at the subnational level to give feedback, and we've trained them on how to collect data and conduct interview and give feedback. So technology was very easy for us to deploy to get information. And so particularly Twitter. So I can give a few examples. When the NNPC, which is the government oil company, committed $30 million to fighting COVID-19, we engaged them on Twitter. So rather than write freedom of information letter and email, we just engaged them on Twitter at their verified handle. And they responded in less than 30 minutes, giving us information on how they are going to utilize the money. You know, here in Abuja, we engaged the FCT minister and on Twitter, you know, using a hashtag. So government is also engaging us because they see we have millions of followership with our hashtag on Twitter. So they're also using that platform to provide feedback and provide answers. But we've also identified opportunities to, you know, scale on investment on infrastructure, particularly on mobile, you know, infrastructure. In Nigeria, every household have mobile phone, but not all of them have access to internet. So we've also identified that gap where private sector and government can work together and have like a PPP where they can ensure that, you know, there's a technology infrastructure that reduces also the cost of internet, because in this part of the world, internet is very expensive and relatively slow. So there's also a conversation that we've triggered around that aspect. And then lastly, we get citizens to also give us feedback. We have a toll-free number. So if you have a mobile phone, you can just call us and we bear the cost. You know, with support from Usiwa, we've been running that toll-free number for over a year now. So that's how we leverage on technology to gather data and also give feedback and bridge that communication gap between government and the people on the ground. And we are just a bridge.
Thanks, Hamdi. Masana.
Great, then I won't take too much time, Zuki, because I have been engaging in the chat box. But maybe just to add to my current reflections and, you know, just thinking purely from a global political economy perspective around collective action and also engagement with the West and their conception of this so-called third world, right? That is a creation of decades of exploitation. Really, you know, the impetus for the African Continent Free Trade Agreement was really to, I think, push back against the global political economy and its heavy extractiveness across the continent. And so I think one of the reasons why we do need solidarity, not just within the African continent, but across the global South, is that any individual country that implements capital flows, that puts embargoes or controls on exchange rates, or invests in public infrastructure rather than using growth indicators for performance, will face a global backlash, not just from capital, but from IFIs. And so for me, the future of global solidarity in terms of systems thinking is how do we build a global solidarity where states are able to regain control over their monetary and fiscal policy. But then how can we do that when we exist in a context where states are fundamentally, I think, antagonistic to the efforts of civil society? And this is what really concerns me about the COVID-19 response, is that the antagonism frames civil society either as anti-developmental or as agents of the West, right? So even interrogation into corruption expenditure, you can't win whichever side of the coin you're flipped on, right? And so there really needs to be a lot more accountability, I think, not just for expenditure, but also for the narrative around the real work that civil society does in ensuring that, you know, social justice is at the heart of COVID-19 expenditure, even as our states push for more control of their policy, fiscal and monetary policy. Thank you.
Thanks, Masana. Sorry, I was struggling to unmute myself. I think next was Wanjiru.
Right, and the question, I think, is about the context for transparency, accountability, participation in for debt in Kenya. And I'll answer this by saying that obviously, like I said, we have a robust public participation, public finance management framework that provides for transparency, accountability, participation, and at each stage of the process, parliamentary approval is required. But there's a loophole when it comes to debt. We haven't had a debt policy in Kenya. So the debt management office as set up is not a very strong office, and has not then been independent of executive pressure. So the debt procurement process, which is initiated in the Treasury, is then heavily influenced by the executive, by the Office of the President. So this has been a problem. So once debt decisions to procure debt are made, they then move to Parliament. And we have a situation, like I was explaining, very interesting in Kenya, where we have a very vibrant and progressive constitution, but we then have a regime that is really rolling back and violating the constitution, you know, in a manner that is actually a very big concern, of course, to us. But that destabilizes our working. So, you know, we're working on a basis of democratic engagement, but we have an administration that's really very authoritarian and violating the law. So what has happened in this case is that because we did not have a free and fair election. We had an election that was contested. Actually, we had an electoral presidential decision around the presidential announcement that was annulled by the Supreme Court, and you know that played out in a manner where the electoral process was not able to rein in the administration, and through that we have possibly very heavy rigging. But one way or the other, we then have a parliament that's very beholden to the executive, that then does not check, has not been able to check executive decisions around debt procurement. So, you know, I'm giving a long story, but the long story short is that parliamentary oversight has not worked. The other aspect we have, because the Constitution of Kenya sought to devolve power. And this was important because Kenya comes from an authoritarian background. It's easy to forget that. You know, we suffered under a very authoritarian, a very brutal regime until the mid-1990s, you know, when the second liberation really took off. And so our constitution encapsulates the aspirations of the second liberation. But, and one of those aspirations is the devolution of power, because we had centralized power, we had very high inequality. So we've got very progressive, you know, you come to the Nairobi city, you go to Mombasa, and, you know, you have very good developments. You've got, you know, especially at the African level, you've got a lot of very progressive development, but then this is not equal. We've got large parts of the country that have been left out. So devolution is key to equitable resource, distribution of resource, equitable development. But our debt procurement then lacks the intergovernmental safeguard, because at the point where the laws were being crafted, we advocated very strongly that, you know, much as the procurement of national debt is the mandate of the national government, county governments require a say, because at the end of the day, they will be impacted by these decisions. And we looked at regimes in South Africa, New Zealand, Canada, in other parts of the world, but obviously this was not taken up. So the lack of voice by the county level, the weakened status of the Senate, which is we have a bicameral parliament, and the Senate serves to protect the interests of the devolved level of government, but this body is then weaker. So this has then weakened the responsiveness to county interests. And, you know, public participation really, under the Constitution, the responsibility for establishing frameworks is done by the county governments. So public participation has been weakened because of continued centralized power in the national government. And then, like I said, we then have a disconnect between appropriation and expenditure. And you know, our view is this is very intentional. And so government has not been able to account for where money goes. So one, procurement decisions, debt procurement decisions are being made in this very political context. We're not able to get the conditionalities around the debt, especially the sovereign debt and the bilateral debt agreements. And then when it comes to the expenditure, you know, especially with the private commercial debt, government has been unable to account for where this money has gone. So we have huge, you know, we've seen some very large cases, you know, high cases of corruption, with money not being, with money actually not being put into the consolidated account. And then once it's been appropriated, then government not being able to account for it. So the status of transparency and participation in debt is, I would say, on the books, you might say, great, government is publishing all its budget reports. They are on the website, but then the crucial information is missing because we don't have the policy framework that requires government to give that detailed accountability. And then the administration has been able to work around the loopholes to really misuse debt.
Thanks, Wanjiru. Thank you for that. And sorry to have to cut you off.
No, that's okay. That's okay.
Yeah. So we have now just a few minutes remaining, and in that space, we'd also like to hand over towards the end for Yokai with a quick poll, a very quick one, and just some quick announcements. But in the interim, we have had perhaps we'll reach out for two additional questions, two final questions. One quite specific to Udaman, sorry, and that's asking about how collaborative the Tracker project has been with national and subnational governments in terms of providing data. And perhaps then to Musa as well around this overarching question in terms of future perspectives. So I think we'll keep it to those two questions for now, and with keeping in mind that we'd like Yokai from Global Integrity to wrap us up. So Udaman and Musa, I don't know if you've got reflections, and if there is, of course, anything pressing, I will do one super quick hand if anyone does have a pressing hand from our participants. Also noting there are other questions which we may not be able to answer now, but we will perhaps ask to have a follow-up from, if it's detailed answers from our speakers.
Okay, and thank you very much. When the whole issue of COVID started, despite the lockdown, we try as much as possible to see how we can leverage on our community champions, because we have over 1,000 community champions across the 36 states in the Federation. So they try as much as possible to give us feedback. They track the conditional cash transfer. They also track the school feeding program and also the government palliative, both state and federal, and their local representative at the National Assembly. So we got feedback from them how these funds were being spent and how some of these palliative items were being diverted and things like that. So we try as much as possible to also see how we can also give this feedback with our collaboration with the respective agency, because we have a partnership. We are into collaboration with the Federal Humanitarian, Ministry of Federal Humanitarian, which basically is responsible for the conditional cash transfer and also the school feeding program. So we try as much as possible to track this program and also report cases where they were not getting things right, and also with our collaboration with the Anti-Corruption Agency in Nigeria, which is ICPC, to also report our findings to them, and they also swung into action to address those issues with reports.
Yeah, thanks so much. Yeah, thanks so much. I think this question is really important and interesting because just a couple of months ago, we could not imagine like the way the lockdown is running and is happening around the world. And some countries like ours been really struggling without any kind of interaction with abroad in terms of commerce, in terms of health things, in terms of economic stuff. So now people realize like what's happening right now in the country is more than important from now to focus much more in certain investment and also in certain engagement inside the country. And now what Accountability Lab is taking the lead and building so high and so strong is building incredible coalition from different civil society organizations not political one, but civil society organization, and how to focus and push the ones in the power to be more accountable in such way, not just in terms of financial, but also the decision they're making every day in the name of the community. And how we do this is creating things from bottom up, like we have representations all around the country. Through them, we have conversation about what's happening in the area, decentralized places in the country. So how we can gather information, spread the right information, not fake news, not rumors, but how we can focus on the right information and take action to push them for the future we want. So we sure, and everyone elsewhere in the country now, things will never be the same from the COVID-19, but how we can think and how we can develop where we want to be from this pandemic.
Great. Wonderful, Musa. Thanks for that. And I will now just really like to extend our gratitude to each of our speakers. Really insightful, really fantastic reflections. And I think I do see some of the questions, one in particular around responsiveness from different governments. And perhaps that might be a conversation that we take forward. I think it requires a detailed response, a question from Joe. And I think what does seem to be coming out of each of the responses and each of the inputs is that there is also a need to take a closer look at some of our legislative spaces and some of the oversight questions in relation to that. So across the countries, I am picking up the reflections around emergency procurement and emergency budgeting, and allocations need not be an excuse for things for systems to be undermined and for accountability to be undermined. And I think we're seeing that and hearing that in different guises. The work we're hearing about is really exciting. I will stop there and hand over to Yeo Kai from Global Integrity, who, in addition to thanking our speakers, has also got an announcement to make and a quick poll to undertake. For the questions and observations that we have not shared, we'll be sure to kind of collate those and include them in an email follow-up. Yeo Kai. And just while Yeo Kai gets her audio on, also would just like to say to everyone, we'd really welcome inputs around what our next webinars would look like. If you would like to interact and contribute to the next sessions of webinars from your various vantage points and organizations, also really welcome. This initiative, Account for COVID, is an open one and one that we hope to grow. So please do feel free to reach out to us in that regard. Yeo Kai, I think you might have been muted in that space. I'm now handing over to you.
Yes, thank you, Sophie. I wanted to bring your attention to an upcoming webinar that is being hosted by the Open Central Africa Coalition. So if you are interested in wanting to learn more about combating kleptocracy and how civic actors in Central Africa are doing that, there is a webinar happening tomorrow at 10 a.m. And the Open Central Africa Coalition is inviting you to participate in that. There's a link that I added in the website for registration in the chat box. So this coalition consists of civic actors in Cameroon, the Chad, the Congo, and if you would like to participate in that as well, and Equatorial Guinea as well. It will be moderated by Elsa Peraldi, which is the Manager of Integrity and Corruption at Global Integrity. So that is happening tomorrow at 10 a.m. So please, if you would like to participate in that, you are welcome to do so. And I would like to point out that this initiative, the Account for COVID initiative, is a series of webinars. So I would like to, has the poll, if everyone has managed to enter the poll, it is asking for you to solicit your input in terms of how we can improve the webinars, and also if you would like to shape the next series, what the next webinar topic will be. We'll be looking at various topics, contracting and procurement, anti-corruption, a closer look at expenditure tracking, access to information, the socioeconomic impact of COVID, closing civic space, as well as health and basic service provision. So if you are interested in any one of those topics, we will be in touch yet again to inform you of the next webinar. And if you are interested in participating in the Account for COVID initiative, maybe more actively, or perhaps leading on any one of these webinars topics, we're more than happy to have diverse group of actors input and shape our conversations. So please do feel free to get in touch with us. And I will put in the chat box a Global Integrity email for further information, and if you would like to contact and participate more actively in this initiative and the webinar series in general. And then, yeah, Suki, I will end the poll now, and we will be sharing the recording and the presentation slides and other resources if you'd like to engage a little bit more with the panelists that have presented here today.
Great. Thank you very much, everyone. Have a great morning and a great evening and everything in between. Thank you.